Is number 21.
Next item on the work session is corrections. George, how are you? If you would like to come forward, please do here, and we'll get started.
Don't be
We
shy.
don't like people.
George, you already answered all our questions when we took the tour, you know, we're.
Oh, very good. Yeah.
If you could
Good morning,
state
everyone.
your name for the public who's they're recording today.
George Calaramakis, Director, Wicomico County Department of Corrections.
Angela Morton, Finance Administrator.
What we'd like to do, George, really just start off, if you just want to give us an overview as far as the department and where you've seen any specific changes or benefits that have been relevant to the budget.
Well, the most significant one is the one we're in the process of amending the personnel manual for the overtime, where our security staff will be paid overtime after 40 hours in a work week as opposed to 171 in a 28-day cycle. And that's obviously dependent on the passage of the legislation coming up.
Yeah, we appreciate you bringing that to our attention. And I know we talked about it on the
Yeah.
tour. We know how important that was to you and the department as a whole, so we appreciate
Well,
that.
yeah, it's very important for the staff, and it's much appreciated that the county executive saw that as a big issue that needed to be addressed, and that you all, as a council, have unanimously supported it. We greatly appreciate that. So the budget does reflect the increase in overtime to accommodate that, which was about $250,000 over prior years. The other areas where we have a significant change, or a change, is in our medical contract. Our medical contractor put forth two proposals for staffing increases, one for a 7-day and one for a 5-day. And after weighing it, we believe there's more than enough justification for the 5-day request for a nurse on a night shift. Our population, while our average daily population has declined from several years ago, I go back to 2011, we're probably about 100 inmates below per day in our daily average. What they refer to as the medical acuity of the people coming in is substantially higher. We haven't experienced any drop in our medication. We haven't experienced any drop in our mental health interactions, with the population. And the medical, what they call the nursing protocols, have doubled from about 15,000 in 2011 to over 30,000. And a lot of that is probably due to the increase in people that are coming in addicted to drugs. They require monitoring for up to 30 days when they're detoxing. Those interactions occur initially, hourly, and then gradually phase down to once a shift. But our diabetic population has increased, our hypertension population has increased, and certainly our mental health population. We're experiencing a much higher number of folks on suicide watch on average. I mean, just last week we were as many as 7 people on suicide watch, and that requires more oversight from the medical staff and certainly the security staff. We're monitoring them at least 4 times an hour during that status. So, and we don't have a medical, we don't have a mental health unit per se. So when we're monitoring people. They're in different locations throughout the facility. It takes time to go from each area, and it becomes pretty much a full-time assignment for somebody when we have when we have 4 or more on suicide watch. We just have to detail somebody 24/7 to do the checks.
How do you decide that? I mean, do they just say, I'm going to kill myself, or is there an actual interview process, formal?
Yeah, that is the magic word. I'm thinking of hurting myself. If they suggest it, we have to take action. And in that process, I mean, they are talked to, but until they have the opportunity to meet with a mental health professional who can then make a better determination as to their risk level, we have to put them on that status. But for the most part, the people who are on that status have a history of that type of experience. They come in, just like we had a person come in last night, and the family knew they were coming, and they called our department and talked to a supervisor and said, please know that our loved one is been known to attempt suicide. So he might not tell you that, but we want you to know that. And if, most of the time that's going to be very credible, and we initially put them on the status until they can be seen and then reevaluated.
Okay.
By our
Are they
mental
put
health
in a
staff.
different cell?
Yes, yeah.
And how often do you check on them?
We check on them 4 times an hour.
4 times instead of every 15 minutes?
Yeah.
Okay.
Every 15 minutes they're
I
being
know they
checked.
had issues in the past, long before you got there.
And we have, all those cells they're in do have cameras, so
They do have.
we do have other
Good.
people monitoring them as well.
Good.
Yeah, and they're in the suicide gear, the smock, and we take
that like
everything
paper?
away. No, it's a very heavy-duty material that would be very difficult for them to try to tear where they could make rope or something
Gotcha.
like that, yeah.
George, you said you didn't have a mental health unit. Have you ever explored designating a certain area of the corrections building into that? And, due to the fact that you seem to, we're hearing more of this every
Right.
year or so.
Yes, to answer your question, we have looked at it. Here's our concern. We do our best to get the people to the appropriate level of care they need, such as the state hospital, as quickly as possible. Normal turnaround time lately has been a couple weeks, and we can get them there. One of the concerns I have as if we were to create and properly staff a mental health unit, it would stay full. And
name it. And name it that.
yeah.
They've got one of those units over there.
We used to, from experience, we were averaging 3 to 4 juveniles coming into the facility a year up until about 3 years ago. And then we saw certainly a spike in juveniles being charged as adults and staying in the adult facility. So we had to create a juvenile ward, and it pretty much stays full, and sometimes we have overflow. And again, right now there's an urgency to have the hospitals accept them because we don't have a facility. If we had a facility, I'm afraid it would work against us. And not only, I mean, we have the mental health care there 5 days a week. And we also have on-call mental health assistance when we need it during off hours and weekends. So we've got our bases covered there, I believe. And that is one of the other increases. We have an on-call mental health service that we've been funding through our welfare fund prior to now, but we've asked to put it into the general fund expenses. So we can continue to use the welfare for the programs that don't come out of the general fund. And the only other increase was a slight increase in food service costs. You all are somewhat familiar, I think, with the Justice Reinvestment Act, and we don't know quite yet what the results are going to be, but if you read the from the legislative analysts, their forecast for local corrections was going to be a significant increase in their budgets because of the sentencing changes that are occurring, sentences that used to be more than 18 months and where the offenders would be sentenced to the state system. Most of those drug-related charges are now going to be maximum 18 months, and they're going to be sentencing them locally. And again, with the increase in drug activity and drug use that we see in the area and in the country, certainly the numbers from a couple of years ago in terms of who went to DOC that would likely come to the county now, those numbers are going to go up. It was, at the time they did the study for the state, the initial Justice Reinvestment Act, I think we had about probably 20 people or so that were at the state level that would have otherwise been at the county under the new law. So, and those were, that data is about 3 years old at least. So I think now we'd probably see a lot more. And we've already seen changes in the sentencing judges are doing and keeping more people local who have drug-related charges.
Yeah, that was about a 5% increase alone, wasn't it, in your?
Yeah,
The
it was
food.
about 30,000 or
Yes.
so. Yeah.
32.9.
Yeah. So those were the main areas, the mental health, the food service, and the medical. Everything else is pretty much status quo.
Okay. John?
I have one question. Why are we paying tipping fees?
I've asked that same question. It's
Okay.
doing business. They're an enterprise account, and we're not, so.
Okay. All right.
Don't we send prisoners out to pick up trash that ride in the van?
Yes, we do.
And do
Should we waive those?
Do we get paid for that, or do you get paid for that? It's-
They reimburse us for the officer's salary, and they pay for the vehicle usage.
Uh-huh.
So the labor is, we don't charge them back for the labor.
Okay. Maybe we could convince them of in-kind.
Yeah, when Weston was in his former role, we had that conversation a couple times, and then they promoted him, so he didn't get to finish it.
And
so.
now that he's promoted, you might be able to get something done, so,
Yeah, yeah.
Well, I think it's to evaluate what the true expenses are in each department.
Yeah, I think it does help.
Yeah, that's fine,
Yeah.
yeah. We realize why it's done.
I mean, there is a fair amount of tonnage, and we do our share of recycling. So, I mean,
Yeah.
we have cardboard, plastic, metal. We do as much recycling as we can internally.
Any other questions?
No, but I would like to bring one thing up. You know, we all get calls, I know I do, about family members and things that are, and I want to thank you for your response when we call you. You know, it's very open with us. I appreciate that.
Glad to help out.
Okay.
I just want to say I appreciate the tour of the facility we took earlier this year. That was very informative and eye-opening. I didn't realize our facility was so large. We had so many people here. You know, it's kind of, yeah, I mean, it's a little bit sobering to, to consider just how big of an operation, the county, jail is. I mean, it's not a small-town jail. It's a large facility.
Well, people recall when the county jail was located, behind us on the top floor of the courthouse. And we're now the sixth largest facility in the state, So it is a very large operation. And even though we're a rural area economically, when it comes to social problems and community problems, we share all the ones the big cities have.
The sixth largest in the state.
Sixth largest local detention center, yeah.
You got 23 counties in Baltimore City. And
Yes.
So that speaks volumes.
Yeah, and that's based, I'm basing that on the daily population that we maintain. And, but also our potential for beds is over 500, so.
Are the majority of them serving time, or are they waiting for a prison sentence?
About 2/3 are pretrial,
2/3.
and about a third.
Third.
It's been the average.
serving a
It-
sentence?
It goes between 2/3 and 50/50, but, and a lot of times, the people who are sentenced also have other unadjudicated charges, you know. They get a new charge and they're waiting on a violation of probation or something like that. They violated with the new charge, so we can't do too much with them until all the charges are adjudicated, so.
When the county was doing, I guess they were holding prisoners for ICE, there was a contract or something, that space that was used for them is currently filled?
I'm not sure at the time. I wasn't the director at the time. There was several locations, I mean, that they used on the blocks. They dedicated certain pods for them. And then, you remember, there was that period they took over the Drill Academy out there.
Right.
But that was a potential site. But back then, the population was, at times, from what I understand and read, like it was over 600. And that meant you had people on makeshift beds
Right.
all over the place. And it was very unsafe. I mean, that wasn't a safe environment to be in at all.
What's your average occupancy right now?
Right now, our count runs about 350, you know, fluctuates a little bit. And out of that 350, on average day, 30 people are somewhere else. They could be in another jail on the shore because of co-defendants, or they're going to testify for the state, and so we separate them from the people who they're going to testify against.
Right.
And we have probably now about half of that 30 are probably in state hospitals.
So is that a 70% occupancy?
Yeah, about.
70.
Yeah. So,
Any other questions?
Do you get any, I know there's been kind of a crackdown on the immigration. Do you get any ICE people bringing folks in or anything like that?
yeah, we go through a process when someone is booked into the facility through the normal questions that we ask. We do ask the question in terms of their country of origin is the question that we ask. But now, with the technology, when we book them in and we take their fingerprints, the system is called Live Scan, and it sends the prints to the state depository, which then sends them to the FBI and to ICE. So normally, within a few minutes, people in ICE monitoring centers around the country, I think Chicago is a big one, they look to see if any of these folks match people that they're looking for. If they do, they call us. And we're fortunate that the local ICE offices are about a half a mile from the facility. So we don't, if there's somebody of interest to them, we don't hold them very long. Sometimes it's just a few hours and they come and get them.
Do they bring people to you to hold?
No, right now, Worcester County
Worcester
on the
County,
shore
okay.
has the contract for
Okay.
the housing.
And they get reimbursed for that?
Yes,
Okay.
yeah.
I see.
And they have to, and I will add, they have to meet a number of federal requirements. And one is, you've heard us talk about PREA before, and the cost associated with being PREA compliant, which we're working toward that certification right now. But again, there is significant cost involved. And some things, just physically, the way the building is, we can't accommodate. But when you contract with the federal government now, whether it's for marshals or for folks under immigration, the contract requires you to be PREA compliant, be audited every 2 or 3 years by PREA auditors, which is an expense, not a big one, but it's several thousand, about $10,000. It could be up to $10,000 every time you're audited. Then obviously you have to have staffing that can support the supervision.
Any other questions? Well, we appreciate you coming this morning.
Yeah.
Thank you very
Well,
much.
thank you for your questions. And thanks for coming out and your support on the the new legislation.
Good job, Angela.
Could we? I'll just keep going.
Yeah,